Yeah, I think Mikhail Van Huylen and Shilpa Gupta and other people who are presenting these data sets have done a fabulous job. Firstly, I think the data sets, it's very clean, and we tried very hard for a very long time to beat platinum-based chemotherapy, and because of that, EV-302 is a very robust study in my opinion, and because of that, every subset that we look at, EV Pembro EVP outperforms platinum-based chemotherapy, and we showed nice data from a response perspective, a PFS and an OS perspective, and we showed across different groups of patients, and I think it's fair to say that this issue around who are the patients who should still get platinum-based chemotherapy, and is there a relevance of platinum eligibility? And my answer to those questions is almost none. And I don't think it's that relevant in the first-line setting anymore. And if you were a patient who pitching up to a hospital in the United States with access to the combination as it currently stands, I wouldn't be umming and erring about which regime to give. I'd be actually giving EV Pembro, but I'd be counseling the patients really carefully about rash during the first 12 weeks, about adverse events like transaminitis during the first period of therapy, about immune-related early toxicity, about cumulative peripheral neuropathy, about other side effects, strange side effects, which we haven't talked a lot about yet. Because of course immune therapy can cause the weird and the wonderful. I actually think in these trials in the past, because chemotherapy and immune checkpoint inhibition have been somewhat antagonistic to each other, we haven't seen a huge spike in immune-related toxicities in 130-361. But I think when you give EV Pembro together in the frontline setting, I think there's certainly, I don't think there's antagonism between the drugs. So I think what's happening is you're getting this really powerful immune response, and I think that it's more like giving immune therapy, which is associated with its own toxicity. So I think the EV Pembro regime is not more challenging than platinum-based chemotherapy. I think platinum-based chemotherapy is really tough. I've got a patient on the ward right now who's had 2 cycles, admission, renal failure, sepsis, neutropenic sepsis, and the cancer's growing on gem carbo. And so the platinum-based chemotherapy story was never a good one. And I think replacing that's been great. I think we replaced it from an efficacy perspective. I also think we replaced it from a toxicity perspective. As I said previously, there's not a patient where I wouldn't give them EV Pembro, I'll give them gem carbo, it's going to be fine. And that's not how I look at this. But I do think we do need to discuss, educate, train around these adverse events, particularly that skin rash and some of the others during the first 3 cycles, like transaminitis. It's a very exciting time in urothelial cancer, honestly. The vast majority of patients receive platinum-based chemotherapy second line. Actually, when we showed that data at ESMO, and I think that makes sense. I think just a small observation: the median progression-free survival was 12 months, but the overall survival was 30 months. So their patients do pretty well after progression. Now, some of them will continue on EV Pembro. If you've had a deep response to therapy, as we saw with EV Pembro, you can relapse. So your cancer can start at 10 centimeters. You can go down to 1 centimeter. If you go from 1 centimeter to 2 centimeters, that's progression of disease. That defines progression. It's not going back to the original 10. So there'll be many patients who do well, who progress, and those patients who progress, then there's an issue about, do you need to change therapy? Should you keep going with the same treatment? When do you need to change? Should you only change when the cancer goes back to where you started, or should you change at the first site of progression? And then, of course, the issue is, if you had EV Pembro, have you got peripheral neuropathy? And if you've got peripheral neuropathy, how easy is it to give platinum-based chemotherapy under those circumstances? I don't think sacituzumab govitecan is going to definitely be better than platinum-based chemotherapy. We don't know that yet. I'd like to see a trial along those lines. And this whole area is an area that is yet to be defined, and I'm excited to take part in that journey.